EMT Prometric questions and answers. Questions 91 to 100. 91. After an initial attempt to ventilate a patient fails, you reposition the patient's head and reattempt ventilation without success. You should next: A. Assess for a carotid pulse and initiate CPR if necessary. B. Use a flow-restricted oxygen-powered ventilation device. C. Initiate airway obstruction removal techniques and provide transport. D. Continue to reposition the patient's head at the scene until you are able to secure a patent airway. The answer is C. Initiate airway obstruction removal techniques and provide transport. 92. A 40-year-old patient sustained full equals thickness burns to the entire head, anterior chest, and both anterior upper extremities. Using the adult rule of nines, what percentage of the patient's body surface area has been burned? A. 18%. B. 27%. C. 36%. D. 45%. The answer is B. 27%. 93. When assessing a patient with a complaint of chest pain, which of the following questions would you ask to assess the Rin OPQRST? A. Did the pain begin suddenly or gradually? B. What were you doing when they began? C. Is there anything that makes the pain worse? D. Is the pain in one place or does it move around? The answer is D. Is the pain in one place or does it move around? 94. Which of the following describes the most correct method for inserting a nasopharyngeal airway? A. Insert the device with the bevel facing the septum. B. Insert the device with the bevel facing the lateral aspect of the nose. C. Rotate the device as you insert it into the right nostril. D. Apply firm, gentle pressure if you meet resistance during insertion. The answer is A. Insert the device with the bevel facing the septum. 95. Which vital sign is the best indicator of cardiac output during the initial assessment? A. Pulse rate and quality. B. Systolic blood pressure. C. Quality of the respirations. D. Condition and color of the skin. The answer is A. Pulse rate and quality. 96. After assisting a patient with her epinephrine auto-injector, you should dispose of the device by A. Giving it to the patient to have it refilled. B. Placing the device in a red biohazard bag. C. Placing the device in a puncture-proof container. D. Replacing the cover and putting it in a trash can. The answer is C. Placing the device in a puncture-proof container. 97. Which of the following assessment findings would most suggest a systemic reaction following ingestion of a poison? A. Nausea and vomiting. B. Burns around the mouth. C. Tachycardia and hypotension. D. Difficulty swallowing and burning in the mouth. The answer is C. Tachycardia and hypotension. 98. You are at the scene where a man panicked while swimming in a small lake. As you attempt to rescue this patient, you should first A. Throw a rope to the patient. B. Row a small raft to the patient. C. Swim to the patient to rescue him. D. Attempt to grab the patient with a stick. The answer is A. Throw a rope to the patient. 99. After removing a patient from the water, your assessment reveals that the patient is breathing inadequately and is continuously regurgitating large quantities of water. You should manage this patient by A. Alternating suctioning with artificial ventilations. B. Performing abdominal thrusts to remove the water. C. Placing the patient on the side and press in on the abdomen. D. Initiating artificial ventilations after the patient stops regurgitating. The answer is A. Alternating suctioning with artificial ventilations. 100. Your first action in managing a patient with an altered mental status should be to A. Give the patient oral glucose. B. Administer 100% supplemental oxygen. C. Make sure that the patient is breathing adequately. D. Try to determine the cause of the altered mental status. The answer is C. Make sure that the patient is breathing adequately.